Good. Oh God. Um, oh, maybe.
Hi, can you hear me?
I must be.
Hello. So sorry I'm running a few minutes late. I was at the campus till 4 o'clock today. It's back home. Give me 1 second to pull up my notes, okay?
Mm-hmm.
Okay.
Oh.
Almost got it. Give me one more second. All right. Okay, so let's start with med surge. Can you guys hear me? Okay. All right. So let's start with med surge. You should be talking about surgical. Um, remember the different stages of drainage after an incision is made, like the serous, and sanguineous, and that kind of discharge. And then being able to identify signs and symptoms of an infected wound, right? So, like tenderness is a given, right? Because we just cut them open. But what are some other symptoms or signs of possible infection? Okay. For skin, most of this test is probably going to be on skin. There's going to be several questions about burns. So in your book, you're going to see some pictures with like the body. It looks like it's called the rule of nines. So looking at like if their arm is burned or their torso is burned. So on the test, it'll give you some examples, and you should be able to calculate the percentage of body surface area that's burned. For skin cancer, knowing the different types of skin cancer, basal cell carcinoma versus squamous cell carcinoma versus malignant melanoma. The sign, how are those lesions different from each other? And then what are skin cancer prevention? And how do we treat skin cancer? Okay. What are some chronic conditions that delay wound healing? We talked about that.
Malnutrition and diabetes.
Yeah, things like that, right? And then skin lesions. So knowing the difference between herpes 1, herpes 2, herpes zoster, psoriasis, eczema, impetigo, those kind of things. Knowing how does that present? Just kind of general stuff about treatment, patient teaching points, like how does it spread, does it not spread, ways to control the symptoms, signs and symptoms of an anaphylactic reaction, like urticaria, things like that. There's one slide on the skin PowerPoint that's got 2 boxes with questions. It's an acronym. One is ABCDE, I believe. Oh no, PQRST, and then the other one is ABCD, I think E. And one is about questions we ask about skin lesions, and one is about questions we ask about skin cancer to diagnose if it's malignant or not. So being familiar with those. Lupus as well. What are some skin presentations of lupus? What are some signs that a surgical wound is healing well? Like, what is that type of tissue called? What does it look like? Okay.
Is it when it has a granule tissue or no?
Correct. Yeah. Yes.
And is that considered a primary? Like primary healing? Primary something. I thought I read
Yes. There's different presentations or degrees of burns. So knowing like which one is like superficial versus deep full thickness versus deep partial thickness, things like that. You should know the IV fluid that's given for burn patients. It's not normal saline, it's something else. Yep, LR, yep. Because it's going to pull fluid out of the cells into the bloodstream so they don't go into shock. So lactated ringers will pull fluid because what happens in burns is the fluid wants to run away from the heat, and so they go into the cells and they swell up. But we need fluid. They're at risk of going into shock because of the loss of fluid. So we need to pull that back to the bloodstream. Let me see what else for med surg. 1 second. Oh, yes, like compression stockings, sequential devices, kind of general teaching for those. Basic teaching about anesthesia, like if a patient says they're going in for, I don't know, an epidural, and they're really nervous about being put to sleep. What might the nurse say? Just knowing what happens with each anesthesia. Okay? I think that's about it for med surg. Any questions on those?
Miss Sally, what are the SCDs for?
The sequential compression devices. Sorry, the sequential compression devices, the compression stockings, things like that. Just basic teaching for that.
So are they the same thing like compression stockings?
No, the sequential compression devices on the PowerPoint, there's little videos. So watch those if you haven't already. But they're like they're plugged in, and they almost kind of look like wraps, like something like almost like a leg wrap. And what they actually do is they pulsate, so they'll inflate and then deflate, inflate and deflate to kind of help get the blood flow moving.
Okay.
Yeah.
Thank you.
Any other questions on the med surg before I move to farm? No? Okay. So I'm going to go to farm, but if you think of a med surg question, let me know at the end, okay? All right. So for farm, if you pull up the PowerPoint that we went over for the anti-infective drugs, well, most of it's going to be anti-infective drugs. There's going to be a few questions that relate to the previous topics that were on the quiz, but for the most part, it'll be anti-infective drugs. So on the PowerPoint, if you scroll down to the penicillin slide, you should know side effects and patient teaching and medication interactions. For cephalosporins, be familiar with those names. Contraindications, who would we not give a cephalosporin to, and the different types of various interactions. For vancomycin, the side effects and the adverse effects. For tetracyclines, the names, side effects, patient teaching for the side effects, patient teaching for the adverse effects, contraindications. For macrolides, the names of those, the patient population, who do we usually give these to? Hint, hint, it's the action bullet. And patient teaching for the side effects. For aminoglycosides, the gentamicin. What do we do first before we give it? Anybody want to answer that?
Performer culture?
Yeah, right, because this is a toxic medication. As you can see from the adverse effects, it's nephrotoxicity, ototoxicity, tinnitus, headache. These are pretty serious side effects. So we want to make sure that this medication is really going to help the infection. Okay? For sulfonamides, which patient population cannot get this medication? It's on the slide.
Allergy to sulfonylurea.
That's right. Yep.
Sulfonylurea.
The thiazide diuretics and the sulfonylureas. Yep. And then let's say they're not allergic to sulfonylureas, but they are diabetic. What kind of patient teaching would we tell our patients? Right. It's on the slide.
It might risk hypoglycemia.
That's right. For fluoroquinolones, so the fluoxetins, You want to know the names, contraindications, who do we not give these medications to, and the adverse effects. Last but not least, for anti-tubercular medications, knowing the signs and symptoms of tuberculosis, doing some patient teaching about how long they're on these medications for. Is it just one? Is it combo, right? It's combo, right? And then what organ is affected primarily from these TB drugs? It's the liver, right? So what the patient teaching that goes along with that, what might the patient expect, right? Maybe testing, right? Frequent testing. And then that last slide, slide 19, be familiar with all the medication names and the associated side effects. That's it. Any questions for me? That's it. If you don't have a question, feel free to log off, but I'll stay on until everybody's logged off to see if there's any questions.
Okay, sounds good.
All right, you guys. Enjoy the rest of your evening. Yes.
How many questions are going to be on the med-surg exam?
75.
Got it. Okay.
And the farm will be about 75. Yeah.
Okay,
Farm too?
Mm-hmm.
sounds good.
Thank you.
All right. Thank you, guys. Have a great evening.